I'm good. How are you doing
Good,
today?
good. Good to see you
Good
again.
to see you. I've been a hospitalist physician since 1998. The primary care physician provides not only general medical care, he or she makes sure that the patient can receive consultation services from other specialties as needed. One of the other responsibilities of a hospitalist is to make sure that the appropriate disposition is cared for when the patient is ready for discharge or when the patient is ready for the next level of care.
I wasn't feeling good. I was real sleepy and kind of just really kind of dragging a lot. I didn't have much energy. You know, a few weeks later, I'm in the ICU at one of the hospitals. You know, I couldn't talk because of the ventilator and the trachea thing, and there was a big period of time there I just don't remember a thing.
After a very complicated hospital stay, we were able to eventually wean him off ventilator. And there were times that we thought that he might not make it.
Dr. Allen's been very upfront with me and honest, and Dr. Allen's he just let me know what's going on, you know, and he's answered all my questions. Always had a really good attitude of coming in, seeing me, and smiling, and you know. But he's also been firm with me and said, "Look, Steven, you really need to do this. You really need to. You have to do this in order to get here, and you have to do it."
Turning point as such was probably when he was able to communicate with me, when he was able to respond appropriately and carry a limited conversation despite being on life support. We have achieved that goal after acute care hospitalization in places such as Village of Lake Highland.
I'm very pleased with the way everything's going here. I'm just amazed. There was a time where I really didn't think I would make it. I would absolutely recommend Dr. Allen to anybody.
I even remember at some point we were thinking about whether or not it may be needed to talk with the family about not pursuing aggressive care. Remembering those days and looking at Steve today makes it worth being a physician.